Hello, Doc Layman with layman terms here, and as you can tell, I have a very abnormal voice. And that's because today we're going to be talking about viral laryngitis, which is what I have. Now, most people throughout their life have had a voice like this, and if you have, it's pretty normal. I want you to know that 99% of the time, laryngitis is viral. What's laryngitis mean? Well, laryngitis means that the larynx, which is actually your voice box, gets inflamed due to an infection almost always. There are some rare other things that can cause laryngitis, but whenever you get this and you feel sick, it's a viral infection 99.9% of the time. If you had a bacterial laryngitis, that's a hospitalization. It's extremely painful. 10 times, 100 times more painful than viral laryngitis. And it is something that would end you up in the hospital. And it's because bacteria like to eat things and they destroy tissue. And so it could actually permanently alter your voice box. However, viral laryngitis almost never does. And so it's something that's self-limited and it will go away, which means it will go away on its own. You don't need to do anything. Other than do the traditional cough drops, tea, honey lemon tea, things to help kind of dry things up back there. And then try not to talk. The more you talk with viral laryngitis, which is kind of funny because I'm doing this video, but the more you talk with viral laryngitis, the typically the worse it can get. And that's because they're already inflamed and you're actually creating more inflammation by when you talk. Staying well hydrated can actually really help the condition. And really, other than that, Dayquil, NyQuil, obviously you need to make sure that you don't have high blood pressure or another heart condition where you can't take a decongestant. Decongestants are things, when you look on the box, something like phenylephrine, oxymetazoline, which is Afrin, and things like that. You can't use those if you have a heart condition, high blood pressure, and there are several other conditions that you should always check with your doctor about. However, one of the safest things to use is a decongestant, it's not really a decongestant, it's an expectorant, is guaifenesin, which is also known as Mucinex. Now, this is not Mucinex DM, this is not Mucinex cold and cough, this is not the other types of Mucinex, it's just straight Mucinex. If you look on the back of the box, the ingredient is guaifenesin, and that's it. That's pretty much safe in everybody. And it helps a little bit. Honey lemon tea helps. I'm also have a doctorate in Oriental medicine. And so one of the alternative things that you could try is something called chrysanthemum tea. And that has been shown to be beneficial. Chrysanthemums are the flowers that you could put in your flower beds. And they have been shown to potentially help with cough and cold. So I just wanted to go over that because I have a lot of patients who get really, really, really worried when they have a voice like this. And it is actually really nothing to worry about. I have been just drinking some green tea sometimes and and I don't have high blood pressure, so I've been taking Dayquil and everything has been going right along. Today is it's the beginning of day 3, but my voice really started to change yesterday. 2 days ago, it was just getting a little squeaks here and there, but yesterday it changed a lot more, especially in the afternoon. I was in clinic, and then now I'm like this. How long can this last? Well, I was actually just talking with a patient yesterday who had it for 2 weeks. And so that's the downside of viruses, is a lot of times their course is not as severe, but it's much longer. And so a lot of people with viral infections, they get frustrated because they're 2 weeks out, 3 weeks out, and they're like, why am I not getting better? Why is this happening to me? What's going on? Can you give me an antibiotic? Can you give me some treatment to make this go away quicker? And unfortunately, typically the answer is no. It's very rare that I ever say, yeah, you need an antibiotic or something, because every once in a while a viral infection can turn bacterial. Now, it almost never happens with laryngitis. I've actually never treated bacterial laryngitis. It's that rare. But it's not that it can't happen, and there are other viral infections that could turn into bacterial. One of the most classic examples is having the flu virus and then it turns into a bacterial pneumonia. That's because viruses inhibit the immune system. They kind of they kind of get the immune system looking at it. Excuse me. But then while it's looking at it, the bacteria will kind of slide through the back door and start to invade and infect. So that was just a little tidbit of information on viral laryngitis. I hope you like it. I hope to be feeling better soon. And if any of you out there have viral laryngitis, I hope you get better soon too. Again, this is Dr. Jeffrey Lehman, and my YouTube channel is in layman's terms. Feel free to click the like button. Feel free to leave a comment, and please share it. I'm just getting started with my YouTube channel, so good luck out there, and I will be posting again real soon. Have a good one.